Thank you so much for that great presentation. We are moving forward. We have Dr. Nadine Gracia was not able to make it. She was called to the White House for a meeting. So in her absence, we have Commander Jacqueline Rodriguez, the Deputy Director of the Office of Minority Health. Welcome.
Good morning. I bring you greetings on behalf of the Office of Minority Health, and as Dr. Gracia is not available to participate in today's conference due to being called to the White House for a briefing. So we know that our office is really committed to dedicating to improving the health of minority populations by developing policies, procedures, and programs that look at addressing health disparities. We understand that health barriers that minority communities face, as well as the stigma associated with HIV/AIDS that prevents many minority populations from seeking medical care and adhering to treatment. We understand that. We know even that we've made significant progress to fight against this national and global epidemic. HIV/AIDS continues to impact communities across our country and around the world, especially our communities of color and the other communities that live their lives on the margin of society. We know over the past 3 decades after the initial reporting of HIV/AIDS in America, this disease continues to be shocking and misunderstood, and its heaviest burden continues to fall upon those who are least likely to have a voice and a place at the table when it matters the most. We know that to acknowledge this stigma, we are facing the virus, the complicated virus. A significant barrier to the elimination of HIV is not the biomedical at all. It's human intervention. What stands between us and an AIDS-free generation is the persistent stigma that even now continues to spread fear, ignorance, discrimination, and isolation, and undermine efforts to prevent treatment and care. Stigma is one of the most significant reasons as to why fewer than half of those living with HIV/AIDS in our country are getting medical care they need the most. Why only 25% of the HIV patients now have managed to achieve control over their infection with medication. And why many people living with HIV/AIDS have no idea that they have the virus because of the stigma. Moreover, we know that stigma is not just a factor in the fight against HIV/AIDS. It also looms over our efforts to treat and prevent other infectious disease and chronic illnesses, as well as mental health and substance abuse. And often, too, stigma associated with these and medical conditions is complicated by the fact that many of those who are infected also belong to vulnerable communities as well as underserved communities. Communities that have too far long been perceived as separate and different. Breaking the silence, we must continue to have dialogues like this to promote open, honest, and respectful discourse in order to turn the tide. Our first action against the stigma associated with HIV/AIDS, mental illness, and so many other health conditions that are affecting our minority communities is to speak the truth about what we're facing by discussing how to address discrimination and despair with the same rigor, attention, and dedication that we commit to the scientific breakthroughs as well as the medical advances. In recent years, one of the signs of hope and progress in the fight against HIV/AIDS has been the recognition that eliminating the epidemic requires a coordinated national response with emphasis on the most vulnerable members of our society. In 2010, the National HIV/AIDS Strategy was our nation's first comprehensive HIV/AIDS strategy. Its vision addresses the future of stigma. And it says that we will become a place where new HIV/AIDS infections are rare, and when they do occur, every person, regardless of age, gender, race, sexual orientation, gender identity, or social economic status, will have open access to high-quality, life-extending care free from stigma and discrimination. As we look at targeting our interventions at the national level, we look at programs like the CDC's Let's Stop HIV/AIDS Together campaign. We also look at how the Office of Civil Rights is conducting investigations of alleged allegations of discrimination against people living with HIV/AIDS and healthcare providers and human service agencies, as well as how they're empowering HIV/AIDS positive individuals by educating them about their health information privacy rights, including the right to access of copies of their medical records. Standing up to discrimination takes many forms and many approaches, and we will continue to investigate, educate, and empower our communities of color as we develop policies and procedures and targeted interventions. At the Office of Minority Health, we are addressing stigma in many facets by recognizing that culture plays a significant role in the healthcare setting. We know that our patients come with different backgrounds, and they want to be able to talk to their providers and be able to be ensured to have culturally competent, high-quality health care. We have programs that we have funded, such as our Linkage to Life programs, that look at the grassroots level. It addresses gaps in healthcare services for members of coming out of prison or having domestic violence challenges. And so many of you are familiar with initiatives led by our Office of Minority Health Resource Center. It's a program called Beat It. The program focuses on the African immigrant population that is vulnerable to chronic infectious diseases such as diabetes, hepatitis, and HIV/AIDS, and often faces challenges in finding providers who will understand their backgrounds and their unique healthcare needs. The Beat It project works with Adventist Healthcare, which is a local healthcare provider in the Washington, D.C. area, to promote improvements in disease and self-management of patients and providing training to assist healthcare providers to deliver culturally competent healthcare. Addressing stigma begins with understanding the community you're serving, from where they are, where they come from, what they believe in, and how that colors their healthcare beliefs. To find out more about how our programs are supporting the stigma, you can visit our website. At the national level, we also have this great moment of opportunity. But because of the Affordable Care Act, it has transformed the landscape of our healthcare system, and it's also showing a brighter future for HIV/AIDS. More than anything else, perhaps leaders in the HIV/AIDS movement may understand that because of the healthcare law has gone so far, that it's not just a website, but the healthcare law is changing the face and the course of our healthcare system. The Affordable Care Act is one of the national HIV/AIDS strategy that shows promising measures for our fight against HIV/AIDS. As you know, the Affordable Care Act has already provided nearly 30% of people living with HIV/AIDS insurance. And they're also been able to provide children who have been denied coverage because of HIV/AIDS and other pre-existing conditions. And in 2014, adults with pre-existing conditions will also have the same opportunities, and that is remarkable at this time. The law is also investing in community health centers across the country by expanding their capacity to meet the needs of minority populations who make up about 2/3 of their clientele. Because of the healthcare law, Americans now have greater access to life-extending HIV prevention intervention than ever before. We are making more coordinated investments to fight HIV/AIDS, many of which come from engaging community leaders like you and embracing lessons learned you have taught us in the field in the fight against HIV/AIDS. But if you have one thing to leave from here today, remember, we have opened the door to greater access to high-quality health care. Now it's your job to help promote the Affordable Care Act. This is especially true for communities who have long been labeled as hard-to-reach communities and have battled against the stigmas and experienced a long list of reasons for distrust in the medical system. We need your help to fight stigmas associated with HIV/AIDS. As trusted leaders in your community, we urge you to promote access to high-quality care at all levels. With policies, science driving us toward a turning point, we have the chance to begin a new chapter in this fight against HIV/AIDS. We have a chance to save lives, a chance to a course of this epidemic that has taken so much from our communities of color. But to make that a reality, we need your leadership on the front lines. We need your voices. And I thank you again.